address you, the COVID positive patient who is being managed at home. And I'm also here to speak to you, the caregivers, who have taken on the charge and the responsibility and who are in fact now part of the healthcare system, as Dr. Troutman said on Saturday, to help with the management of the COVID patient at home. So if we can start with the first slide, I'm just going to remind us all of the self-quarantine and isolation tips that have been described in this slide by the Ministry of Health. If possible, we would ask that persons who are COVID positive sleep in a separate bed or in a separate room. And I emphasize if possible because we are aware, having managed many persons at home, that it is not always possible given the number of persons living in a home and given the number of persons that may need to share a room. But we are saying, please, if possible, and you cannot share a bed, if there is a pull-out, if there is a mattress, something that can be placed on the floor, then the person who's COVID positive would get the bed, and then someone else would share another space so that there is less risk of exposure. Also, if possible, we would recommend that you use different bathrooms. Right? And if it is you're not able to use different bathrooms, then we would need to encourage sanitizing of the bathroom, which I will speak about a little later. And of course, opening the windows to ensure adequate ventilation, and a lot of air circulation is always encouraged when a COVID positive person is being managed in the home. Next slide, please. Wearing your mask, we could never emphasize this enough. When someone is COVID positive and at home, we would ask and recommend that they wear a medical grade mask. The patient needs to wear that type of mask, and of course they need to wear it as much as possible. Because we are home and we're with family and we're with household members, sometimes we may think, you know, I've been around the persons and maybe they've been exposed already, but we really want to encourage us to go back to wearing the mask at home if you've been tested and you are in fact COVID positive. And of course, change the mask regularly. If it becomes wet, if it becomes dirty from secretions, and by change, if it's a disposable mask, of course, it would need to be discarded. Next slide, please. Respiratory hygiene is also something that is very important for the COVID positive person and their household members to be reminded of. You need to practice rigorous respiratory hygiene, and by that, what do we mean? Cough or sneeze into your elbow or a tissue, and then immediately dispose of this tissue, and of course thereafter wash hands with soap and water. Next slide. In terms of self-quarantining and isolating at home, the reason that I'm here is to really emphasize that even though we are managing the COVID positive persons in the home, we still want to reduce as much as possible person-to-person transmission. It should not be assumed that because there is a COVID positive person in the home, everyone in the home must get COVID. That is not what we're saying at all. So again, do not share. We need to stop sharing. We have to switch modes. Yes, these are your relatives, these are your loved ones. But if you are COVID positive and the other members of your home are not COVID positive, do not share towels, do not share cutlery, do not share your glasses when you are drinking your water. And of course, everyone in the home, as we said, wear masks as much as possible and stay away, stay as far as you can from the persons that are COVID positive. Use soap and water to clean face coverings or discard after use. I cannot emphasize enough how much we need to ensure that anything that was used to cover the nose and mouth of a person who is COVID positive, that needs to either be discarded or cleaned appropriately with soap and water. We need to be careful as well when actually handling the mask. So caregivers who are also wearing a medical mask that covers their mouth and nose when they're in the same room as the patient need to remember, do not touch the mask while it's on your face. And of course, when removing the mask, you would untie or unhook from your ears. Do not touch the front of the mask. If the mask gets wet from dirt or secretions, again, we are saying throw it away immediately. Replace it with a clean one. And also, we are asking for the COVID positive persons at home to not move around the home as they normally would. We are asking you to restrict movement. So just like we asked the population to restrict movement by staying at home, we're now asking you, the COVID positive person within the home, to remain as much as possible in one room of that home. You should not be getting up and saying, I'm going to watch a little movie with the family in the living room, and then I'm coming to the dining table, but I'll just sit far from everyone. We are asking for the period of your isolation within your home that you restrict yourself as much as possible to one room in the home. And of course, if you are sharing a space, please, please open those windows. Do not mingle freely. Do not have people coming into your room apart from the primary caregiver. And of course, even when that person comes in, they need to still, as much as possible, not come within 6 feet of you. And remember, no one is scorning you. Your family members are not scorning you. They're not saying they don't like you anymore. They're not saying something is wrong with you. It is literally an infectious disease. And the best way to protect your loved ones would be to allow them to distance themselves from you while in the home. No visitors are allowed. So visitors should not be coming into the home at this time. You're not to have, Tanty and Granny coming to visit the person who is sick because, well, there's a sick person and we need to visit. We have to do the opposite. We have to Zoom call, video call, WhatsApp call, but do not come into the home when there is a COVID positive person. And for items that need to be dropped off to the home, please collect those items at the gate. And this is not the COVID positive person I'm speaking to now. I'm talking to the household members. They need to go to the gate, to the fence, collect whatever items are left there for the person in the home and for you all, and then we proceed to move on. Next slide. So we have here now the image of the toilet, and I thought it was important to even talk about how to share a toilet, because everyone will not have extra bathrooms in their home such that a COVID positive person has their own bathroom. So if you are in fact sharing a bathroom, it is important that you clean the handle of the toilet where you would normally hold to flush. That needs to be sanitized after each use. Many people think of the seat, as being the most unhygienic part, but guess what? It is the handle of the toilet, right, where your hands are. That needs to be wiped. You need to close the toilet lid after each use before you flush, because that will allow, of course, when you flush, particles to not then, be getting all over the bathroom. And of course, keeping your counters clear of like toothbrushes and all of that would then mean you also prevent any particles from landing on those items. There is a way to receive meals at the home. So if you are in your own room, we would ask that people leave the meals for you outside of your door. And when you're finished eating, you leave the dishes on the floor outside of your room. If food is delivered to the home as well, that person who is bringing food again is not to leave the food, not to enter the home, but to leave it by the gate as much as possible. What we're trying to do here, folks, is prevent multiple rounds of self-isolation for members within a household. Because I'm sure some of you would have experienced, you've been home for 14 days or more because someone in the home was positive, and then someone else becomes positive, and it is like you're having to submit several quarantine orders to your employers. So we're trying to prevent that. In terms of the actual considerations, clinical considerations for the person at home, next slide, we're looking at symptomatic treatment. So for persons who are with COVID-19, the World Health Organization recommends treatment as follows. If you have fever, the fancy word we use in medicine, antipyretics. Those are things like paracetamol for fever and pain. But also, if it is you have mild COVID at home, we also need to remember adequate nutrition as well as appropriate rehydration. When Dr. Trotman was here on Saturday, she spoke about dehydration being a very, very basic presentation of COVID positive persons coming to hospital presenting just literally too dry, right? In terms of antibiotics, antibiotics are not to be used as prevention, and we really want to discourage persons from requesting of their physicians, I'm home with COVID, can I get some antibiotics, please? The World Health Organization also advises against antibiotic prophylaxis or for treatment of patients with mild COVID-19. Persons with moderate COVID-19, antibiotics will only be prescribed if there is the signs or symptoms or any kind of suggestion of bacterial infection, because antibiotics will only work for bacterial infections. And of course, our chronic disease patients who are at home, they would need to have their medications always available so that they don't then go into uncontrolled diabetes, uncontrolled hypertension, in addition to having COVID-19. So patients with COVID-19 infection and chronic diseases who are being managed at home, we need to ensure an adequate supply of medication. Older people should always have at least a 2-week supply, and of course any repeat prescriptions and refills, those will be brought to the home and dropped off, but never by someone who is in quarantine, and never by someone who is a contact of the COVID-19 patient. The reason that we need to talk about hydration for the COVID-19 persons is because if it is you get fever, if you develop fever with COVID-19, which then leads to an increase in temperature, what that does is it causes basically you to have an increased need for fluids. And so sometimes, even though you've got loss of appetite and you have, you're tired and you're not thirsty, we are wanting to emphasize to the COVID positive patients today, please keep in mind that you need to be drinking, because you are dehydrated and you may not realize it. You have lost some fluids because of the fever. Drink at least 3 liters of fluid, clear fluids, and of course ideally water, not ever sugary drinks. And the last thing I want to talk about today for the COVID-19 persons at home would be the issue of cleaning, sanitizing, disinfecting. These are terms I know that you all would have heard us use. So I just wanted to say, what is cleaning? Because sometimes we think we're disinfecting when in fact we're just cleaning. Cleaning removes germs, dirt and impurities from surfaces or objects. Cleaning works by using soap and water to physically remove the germs from the surface. It does not necessarily kill the germs, it is just removing them physically. Disinfecting, on the other hand, kills germs. Disinfecting is what we want because it kills the germs on surfaces or objects, and they work together. Disinfecting works by using chemicals to kill the germs on the surfaces or objects, and it does not necessarily clean a dirty surface, but it will kill the germs on the surface after it has been cleaned. And so sanitizing is a term we use to mean lowering the number of germs on a surface or object to a safe level as judged by public health standards or requirements. So this process of sanitizing works either by cleaning or disinfecting. So you're removing the germs and you're also killing the germs. So this is what we mean when we talk about cleaning and sanitizing and disinfecting. And of course, don't forget your cell phones and don't forget your screens, your computers. Cell phones are things that we always have in our hand, and sometimes other people hold our phones, and that's something also to be discouraged. But you need to use disinfecting wipes on your cell phones every day. And of course, pay close attention to the chemicals. Make sure your phone can handle it, and see if it is you need to use more than one wet wipe to clean your phone. When it comes to the waste that is generated in the home from managing your COVID-19 person at home, remember that this would be considered COVID waste, and so you need to put it into a strong bag and dispose of it carefully when you're putting out of your garbage. And I would end, of course, on a very positive note, a message of hope. We thank you, and we thank you, the public, for continuing to be an active partner in the national fight against COVID-19. We thank you for your support, for your coming out for your vaccines, because together, as everyone has been saying, if we continue to wash our hands, wear our mask, and watch our distance, we will win this war against COVID-19.